8:10 in the morning. It's a great opportunity to talk with Dr. Randall Juleff. He is a physician, of course, and leads the vein clinics of Hawaii. And doctor, it's kind of good to meet you. I've heard you many times on air before, and it's good to have you with us.
Good to meet you, too.
Thank you for taking the time today.
My pleasure. My pleasure.
Now, I don't want to bring up sad and troubling news, but we're both football fans.
Yeah.
This will mitigate your sentiments. I'm a Bears fan.
Oh,
So,
well,
thank you for that.
I'll forgive you for that, Rick.
But as a New Orleans fan, it was kind of a tough game.
Yeah, it was. Yeah, it was disappointing because, obviously this is going to be Brees' last year, and so it was heartbreaking that he couldn't, go out with the flair that we all wanted him to, for sure.
Right. But Drew he's so beloved.
Oh, he
back
is.
Home, right?
Yeah. He really, the community loves the guy because he came in at a very crucial point. It was immediately after Katrina, and I think most people, know what happened then. And he really was a big part of, bringing that community back to life. Really, it was such a discouraging and depressing kind of time immediately after the hurricane hit. Football's a huge, thing in that part of the country, as I'm sure you know. And so it really, really helped. It was great.
Yeah. I respect him and admire him. I really do. Not just a consummate professional, but for what he does for the city and his leadership that he exhibits. So,
absolutely.
Well, we got next year. We're both the Saints and the Bears are in first place for next season. So far. And here we go. Would you mind sharing a little bit about yourself, Doctor?
Yeah, well, I grew up in Michigan, outside Detroit. I was sort of a transplant in New Orleans, but I moved there about 25 years ago. But for the last 10 years, I've been coming to Hawaii, and I've had the vein practice here. And it's been great. I got in, I originally trained in cardiac surgery, open heart surgery and vascular surgery, and typically that has to do with the arteries. And arteries are the blood vessels that carry blood, from the heart to the body.
Right.
And about, 10 years ago, I kind of decided to segue into specializing specifically in vein care, and it's been a tremendous change for me. And one of the most exciting things about vein care is that the technology has really exploded over the last 20 years, let's say. Right. Before that time, we were doing stuff like surgical vein stripping for varicose veins and venous disease in general, and those were procedures that we did in the hospital under a general anesthetic, and it was pretty uncomfortable, and a bunch of incisions and all that sort of stuff. And one of the things that really attracted me to get into vein care is the fact that everything we do in the office anymore. Everything we do is done very minimally invasively, so it's just little needle, instead of incisions, we're doing just little needle puncture sites. It's great for the patient. Absolutely.
Right. Technology is such a wondrous development, and we cite this in some of the more apparent things, such as electronics, personal devices, and even if we talk about the news, there's many, many revelations about technological advance. But it's in medicine that is just so profoundly important and has had great impact. Yeah. Just giving, just even with the COVID vaccine development and treatment, et cetera.
Sure.
That has been fast-tracked. But vein care, I'll be honest, do many people really consider the health of their veins? And if they don't, why should they? And secondarily to that, how can they ensure they're doing the best for their venous system?
Yeah, that's an excellent question, because that's really one of the major hurdles that we get over. We have to get people over, right. Because the impact of vein disease on people in general has been tremendously ignored in the past, and I think us as physicians just in general, we sort of minimalized it. Number one. Number two, those people who did go through treatment, again, it was a difficult kind of procedure, and a fair amount of risk just going into the hospital, having a general anesthetic, all those types of things. But it's been made so much easier, and the thing is that often people feel like, gee, varicose veins and all those things that come along with it is primarily a cosmetic problem, and it is not in any way, shape, or form. And varicose veins, what's happening when people have varicose veins? Well, nearly all of those people, they have varicose veins. Those are dilated veins on the surface of their legs. They can see those, and so that's easily identified. But nearly everybody with varicose veins has a problem with the function of the veins that are deeper in the leg.
I see.
And that is why then they develop the superficial signs of varicose veins, spider veins, skin discoloration, that kind of thing. So really what we're treating is the poor function of the veins that are deeper in the leg. Now we get rid of varicose veins too in the process, but the crux of the problem, the root problem, is that abnormal function of those deeper veins. And the other hurdle that we have to get over all the time is, people, there's all sorts of symptoms and problems that people may have with when they have vein disease. We call that venous insufficiency. That's sort of the official name of it. Varicose veins is just one of them. So a lot of people will have symptoms of venous insufficiency, but they don't necessarily connect it because they just don't know. Varicose veins are easy. If somebody develops varicose veins, they say, I have a vein problem,
Right.
But people can have absolutely completely normal looking legs superficially, but the other symptoms that we commonly see are just achiness especially at the end of the day, swelling, heaviness, fatigue, loss of energy in your legs. And then all the skin things that people develop, the brownish discoloration. And, all you have to do is walk around outside and you see people with that dark brown, skin change.
Right.
And a lot of people, will chalk that up to other things, like, well, I spend a lot of time in the sun, especially here in Hawaii, or I have diabetes and, 19 different things. But most of the time, that skin discoloration is a product of venous insufficiency. And that's when we start to see a really advanced kind of problems then with venous insufficiency, when the skin starts to change. Brownish discoloration, people will develop a rashy kind of appearance to their skin. And even it goes on, ultimately it can go on to skin breakdown, chronic ulceration.
Goodness.
And which is terrible. And I mean, and people don't know. People just don't know that all of that is due to, again, something that we call venous insufficiency. It can be easily fixed.
We're talking with Dr. Randall Juleff and the Vein Clinics of Hawaii. Would you mind sharing contact information, please? What's the best way to get in touch with you and learn more?
Probably the best way is to go to our website. We've got 4 offices, not only here in Honolulu, but Maui, Kauai, and Big Island. And go to the website, and depending on what island you're on or where you want to go, the number here is 585-2955.
Gotcha. Just a quick question on
Sure.
my own. Just curious, when conditions occur, people get a little concerned, and then, of course, obviously seek a physician's help. Is there a correlation between neuropathy and vein health? Do they intersect in any way, or are they a parallel condition if you perhaps suffer from one or the other?
Yeah, neuropathy, numbness, tingling, all those sorts of things that we see in the lower leg. Sometimes they're due to venous insufficiency, but a good part of the time they're due to other things. And neuropathy is very much, or can be very much, a part of diabetes or other metabolic kind of problems. But so people, when they come in and they have some of those symptoms, numbness, tingling, burning, etc. I kind of caution them, and I tell them, we may or may not, significantly impact those symptoms. But can neuropathy or some form of it be associated with venous insufficiency? Absolutely, yeah.
Understand.
Because we fix plenty of people, and they have improvement in those kind of things that are going on in the lower leg and feet.
Is there any gender specificity with vein conditions?
Well, that's another thing. I think most people feel like, vein problems, well, that's just, for women. But in women, we do see a little more of it in women. There's a little more of a gender bias there with respect to developing vein disease, but we see an awful lot of men. And I think, and I tell people this all the time, it's got, in our practice here, it's got to be close to 50-50. It really, it's usually a genetic thing. So usually it's in the family history somewhere. It may not be directly in your parents, but grandparents or aunts and uncles. So usually it starts out as a genetic, problem, and then lifestyle things then impact it. And one of the reasons why women have it a little more is because pregnancy can be very, hard on the venous system in the legs. So we see it a little more because of that. Right. But people who work on their feet a lot, that we see that all the time. Yeah. And especially in a community like here, where people are, they work for the resorts or whatever, and they're on their feet all day long. It can be a tremendous problem, because not only are they developing more of it because they're on their feet, but they're also more symptomatic from it because they're on their feet all day.
Self-awareness, very important. Final question for you today would be this. Self-awareness can be enhanced with a self-examination, knowledge about what's taking place with your body. Is there something fundamentally we can do to ensure our venous system is healthy?
We have on the website, we have a virtual screening kind of thing. So there's a bunch of questions. Okay. And I think that I would encourage people to do that. Go to our website and go through those questions and see what you come up with. And also, we've got a bunch of information on the website. And if nothing else, just call the office, and there's always somebody there that can talk to you and discuss those kind of things. Right. People all the time, they say, gee, I don't know, am I overreacting, or is this really enough to deal with? And usually the answer is yes. I mean, you do have a problem, but people sometimes they have to be encouraged a little bit. But there's a lot of information on our website. I would encourage people to go there. And they'll see it. I mean, they'll be reading and they'll be going, oh yeah, gee, that's me.
Exactly. Love that. Telephone number once again before we go.
585-2955.
I really enjoyed the conversation with Dr. Randall Juleff, and of course, Vein Clinics of Hawaii. And both of us will not be watching the NFL action this weekend because both our teams aren't there. Yes. But anyway.
Okay, Rick, thank you very much.
Thank you very much, Doctor. Really appreciate the time. And again, be sure to connect with Dr. Randall Juleff. We'll be back in a moment and take your calls at 521-8383, 824.
KHVH.